Hi, I'm James Warda, Senior Director of Marketing and Communications with the Home-Centered Care Institute, where our goal is to advance home-based primary care. I'd like to welcome you to our first episode of HCCI Conversations with. Today, we have a very special edition with Dr. Thomas Cornwell. Dr. Cornwell is the Executive Chairman of the Home-Centered Care Institute. He's also the Senior Medical Director of Village Medical at Home, which is part of VillageMD. And he's also the founder of Northwestern Medicine HomeCare Physicians. We're going to be speaking with Dr. Cornwell about the COVID-19 pandemic. And as background, Dr. Cornwell is a practicing house call physician. He's been practicing for over 25 years and has personally made over 34,000 house calls. So with that, I'd like to welcome Dr. Cornwell.
Thank you, James.
Obviously, you've been doing house calls for over 25 years, and you wouldn't be doing that if you didn't think house calls were important. But with the pandemic, have you seen the profile of house calls rise? Is there more visibility, more importance for it?
Absolutely. It's all about right care in the right place at the right time. And with COVID, it's obviously a great place for patients to be seen. So one, they don't have to be exposed by others at clinics or the hospital. And two, they don't expose others at the clinic or the hospital. One of the concerns right now is because of the lack of PPE, we're not able to do as many house calls as we would like, but it truly is an ideal place of service for this pandemic.
Getting back to the PPE question, are you seeing more house calls being done through telemedicine, telehealth?
Absolutely. I actually had two new patients today with telemedicine. And that's just another great example of how our country has responded. CMS has just been remarkable in terms of all the changes that they have made in order to enable providers to do visits and literally charge an office visit or charge a house call visit over what audio and visual. It does need to be audio and visual, but they've also agreed to pay more for just audio only calls using the CPT codes for that. And so it really is something that we've just seen explode over the last couple weeks. That is how I've done my visits over the past 2 weeks, and again, including 2 today.
What added impact do you think home-based primary care can have at this time?
A lot of our patients are socially isolated, and there's a lot of fear around COVID. And I think this is a wonderful time for us to do frequent check-ins on our patients. And that is where telemedicine is such a godsend, because it allows us to do those frequent brief check-ins because we don't have to travel from house to house. We can just make those quick phone calls, make sure that they're doing okay, make sure that they have what they need, and just help them a little bit during this time of heightened anxiety to really reassure them and let them know that we are here and make sure that everything is okay with them.
So Dr. Cornwell, earlier in our conversation, you mentioned the changes about telehealth and CMS, and obviously there's almost daily changes around COVID from CMS and all other, a lot of different other sources. How do you keep up with all of that?
That's a great question because, obviously we still have to do all of our patient care. We have to learn how to do it in a telehealth manner, and we have to keep up with all the new regulations and guidelines. And I will say that both the CDC as well as CMS, their materials on their sites are excellent and well updated. I also have found HCCI to be a source in terms of their COVID hub because it's all in one place and it's targeted towards home-based primary care. And so I've just found that to be a great one place to go to get all the information that I need.
One of the things I think it's very important we talk about and point out is that your patients generally are some of the most vulnerable during this pandemic. Can you talk a little bit about that?
Oh, you are so right. In most home-based primary care practices, the average age is around 80. They have multiple chronic diseases. They are all the high-risk population that you do not want to be exposed to COVID. And again, just another reason why telemedicine is so important at this time, and also why when they need it, a house call is much better than having to go out and be exposed to others.
So, Dr. Cornwell, I'm going to ask you to look a little bit into the future here. So let's go forward. Hopefully, COVID is starts to resolve, and a lot of these changes that have been put in place from CMS around telehealth, et cetera, the higher visibility of home-based primary care. What would you like to see have happen with those things to take some of these learnings and really keep them moving forward into the future?
No, with the impact of telemedicine over the past just couple weeks, I can't imagine that it is not here to stay. There is so much value to it. It's going to really depend on how CMS decides to continue to reimburse for it. Before this pandemic, you really, for the most part, had to have face-to-face visits to really get the evaluation and management payments for visits. And so it'll just depend on if CMS continues to reimburse for it. I really think it's here to stay.
What do you hope would happen with home-based primary care coming out of such a large crisis?
No, I really think, again, it has shown its value. We just had a wonderful webinar with HCCI with leaders from Mount Sinai, University of Wisconsin Health, as well as UCSF that are really being called upon by their health systems to really be a solution during this difficult time.
So, Doctor, before we end the conversation, I'm going to ask you one last question. HCCI has a campaign called I Heart House Calls. And so before we go, can you tell me just, I know how passionate you are. Why do you love house calls?
After 25 years, the beauty of this job is I am still amazed on a daily basis the impact that it has on these homebound patients as well as their caregivers. The difference you can make, because most of them have gone from a fragmented acute care system, being hospitalized a lot, and really enabling them to stay at home. The last thing I'll say is this has been shown to reduce 90% of nursing home placements. And what a joy to be able to fulfill families' wishes to keep their loved ones home and then just give them this loving care. It's a dream to me.
I really appreciate your making the time to do this. And we look forward to talking to you again soon. And also thank you to everyone who took the time to watch this video. You will be seeing more episodes of HCCI Conversations with in the coming weeks and months. And for those who are looking for some of those resources that Dr. Cornwell was talking about around our education, consulting, and other resources, you'll see that at the end of the video. And we look forward to talking more with you in the future. Take care. Bye.